Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Legal and ethical considerations. A client is hospitalized in the end stage of terminal cancer. His family members are sitting at his bedside. What can the nurse do to best aid the family at this time? Option A. Limit the time visitors may stay so they do not become overwhelmed by the situation. Option B. Avoid telling family members about the client's actual condition so they will not lose hope. Option C. Discourage spiritual practices because this will have little connection to the client at this time. Option D. Find simple and appropriate care activities for the family to perform. Right answer is Option D. Find simple and appropriate care activities for the family to perform. It is helpful for the nurse to find simple care activities for the family to perform, such as feeding the client, washing the client's face, combing hair, and filling out the client's menu. This helps the family demonstrate their caring for the client and enables the client to feel their closeness and concern. A. Older adults often become particularly lonely at night and may feel more secure if a family member stays at the bedside during the night. The nurse should allow visitors to remain with dying clients at any time if the client wants them. It is up to the family to determine if they are feeling overwhelmed, not the nurse. When caring for a terminally ill client, it is important for the nurse to maintain the client's dignity. This can be facilitated by Option A. Spending time to let clients share their life experiences. Option B. Decreasing emphasis on attending to the client's appearance because it only increases their fatigue. Option C. Making decisions for clients so they do not have to make them. Option D. Placing the client in a private room to provide privacy at all times. Right answer is Option A. Spending time to let clients share their life experiences. Spending time to let clients share their life experiences enables the nurse to know clients better. Knowing clients then facilitates choice of therapies that promote client decision-making and autonomy, thus promoting a client's self-esteem and dignity. What are the stages of dying according to Elizabeth Kubler-Ross? Option A. Numbing, yearning and searching, disorganization and despair, and reorganization. Option B. Accepting the reality of loss, working through the pain of grief, adjusting to the environment without the deceased, and emotionally relocating the deceased and moving on with life. Option C. Anticipatory grief, perceived loss, actual loss, and renewal. Option D. Denial, anger, bargaining, depression, and acceptance. Right answer is Option D. Denial, anger, bargaining, depression, and acceptance. Bereavement may be defined as Option A. The emotional response to loss. Option B. The outward, social expression of loss. Option C. Postponing the awareness of the reality of the loss. Option D. The inner feeling and outward reactions of the survivor. Right answer is Option D. The inner feeling and outward reactions of the survivor. A client who had a do not resuscitate order passed away. After verifying there is no pulse or respirations, the nurse should next Option A. Have family members say goodbye to the deceased. Option B. Call the transplant team to retrieve vital organs. Option C. Remove all tubes and equipment, unless organ donation is to take place, clean the body, and position appropriately. Option D. Call the funeral director to come and get the body. Right answer is Option C. Remove all tubes and equipment, unless organ donation is to take place, clean the body, and position appropriately. The body of the deceased should be prepared before the family comes into view and say their goodbyes. This includes removing all equipment, tubes, supplies, and dirty linens according to protocol, bathing the client, applying clean sheets, and removing trash from the room. A client's family member says to the nurse, "The doctor said he will provide palliative care." What does that mean? The nurse's best response is Option A. Palliative care is given to those who have less than 6 months to live. Option B. Palliative care aims to relieve or reduce the symptoms of a disease. Option C. The goal of palliative care is to effect a cure of a serious illness or disease. Option D. Palliative care means the client and family take a more passive role and the doctor focuses on the physiological needs of the client. The location of death will most likely occur in the hospital setting. Right answer is Option B. Palliative care aims to relieve or reduce the symptoms of a disease. The goal of palliative care is the prevention, relief, reduction, or soothing of symptoms of disease or disorders without effecting a cure. Which of the following is not included in evaluating the degree of heritage consistency in a client? Option A. Gender. Option B. Culture. Option C. Ethnicity. Option D. Religion. Right answer is Option A. Gender. When providing care to clients with varied cultural backgrounds, it is imperative for the nurse to recognize that Option A. Cultural considerations must be put aside if basic needs are in jeopardy. Option B. Generalizations about the behavior of a particular group may be inaccurate. Option C. Current health standards should determine the acceptability of cultural practices. Option D. Similar reactions to stress will occur when individuals have the same cultural background. Right answer is Option B. Generalizations about the behavior of a particular group may be inaccurate. To respect a client's personal space and territoriality, the nurse. Option A. Avoids the use of touch. Option B. Explains nursing care and procedures. Option C. Keeps the curtains pulled around the client's bed. Option D. Stands 8 feet away from the bed, if possible. Right answer is Option B. Explains nursing care and procedures. To be effective in meeting various ethnic needs, the nurse should Option A. Treat all clients alike. Option B. Be aware of clients' cultural differences. Option C. Act as if he or she is comfortable with the client's behavior. Option D. Avoid asking questions about the client's cultural background. Right answer is Option B. Be aware of clients' cultural differences. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.